I'm very humbled to be invited to come and talk in amongst all the eminent people and amazing humans that have also come to talk today. The pen is mightier than the sword, and slightly adapting from that, maybe we might say that the pen is slightly mightier than the scalpel, or at least has a comparable skill towards the scalpel. Facial trauma can be a challenge, and as one of my bosses, Riley, said, "Today, son, we're going to be making a potato out of a packet of crisps." And it comes in different shapes and sizes, with different issues. But which bit do you fix first? How do you sort it out? In what order? Do you do it all together? What materials do you use? What can cause problems? Should the patient have input into what they want fixed first? Does it bother the patient?